art helps us to see. We've never seen that painting before. All of a sudden, I'm looking at the painting, I begin to see in different ways because I don't know how to look at that. I'm not an art historian, I'm not an art critic. They actually did a study. This goes back luckily years ago, so we know that it's been replicated, it's been sustained, that started at Yale Medical School. And they took their first-year medical students, who were they were first teaching diagnostic skills, et cetera, and they divided them into two groups. The group that got the normal medical school education and the other group that got the normal medical school education, plus an art history course. So they weren't painting or drawing, or they were just looking at art. And they found that after just one semester, the students who'd gone to the medical students who'd gone to the art history class were much better diagnosticians than the other group. They, of course, didn't trust the results, so they replicated it. And then they got really curious as to why. And so they interviewed both groups, because they're both very bright, very motivated students. And they found that the students who were trained to look at paintings, or who had been introduced to looking at paintings, when they went in to look at a patient, they saw much more. So they may have been told that it was a cardiac patient, but they looked at the skin tone and they looked at how the person was breathing, and and when you interviewed them afterwards, they just had much more data. So they looked at the color, the texture, the themes, the patterns, they looked at more. The second of only two things, and both of them were huge, that jumped out, is when they made a diagnosis, their diagnosis tended to be slightly more tentative. So you have to make a diagnosis because you have to treat the patient. So they would look at everything, and whereas the non-art trained students would say, he has malaria, therefore we need to use this regime. On the art-trained group of students, they'd say, I think he probably has malaria, therefore, okay, that doesn't seem like a big difference, but watch what happens then. A week later, 2 weeks later, if the patient isn't doing very well, the non-art trained students who were so sure of their diagnosis of malaria comes back in and says, either it's a patient compliance issue, they're not taking their medications, that's why they're not getting better, or we didn't prescribe enough, we need to increase the dose, or something within that paradigm of the person has malaria, we need to use the tools that we have for curing somebody of malaria. On the other side, with the art-trained students, they were much more likely, they considered those options too, but they were much more likely to say, did we get the diagnosis right? Is it malaria, or is it dengue fever, or is it whatever? I'm not a physician, so I can't say what the other guesses would be. And therefore, it opened up avenues for actually healing the person that were closed off with the certainty of knowing. Art does not have a right answer. That not having a right answer was brought into the students so that they could see more and they could more easily let go of something that wasn't working. Now, it doesn't take a genius to say if you take those same skills out of medicine but into another domain, all of our businesses, whether it's engineering, whether it's whatever it is, we need to be able to see the situation, bring in as much data as possible, pattern it in multiple ways rather than just one way, make a best guess. Do I invest in this company? Do I go with this merger and acquisition? Do I do a joint venture with this company? If it starts to not work, why is it not working? Is it because they weren't committed to the joint venture? We said we've got the contract, it should be, we all agreed on it, or is it something else? Is it the external environment? Is it something that we missed totally in the beginning? So all of that divergent thinking that goes along with creativity comes out just by seeing a painting. There are lots of other ways in which viewing art supports great leadership skills, but that's just one example.